Looks like people are coming in. Hello, everybody who's coming in. We're going to get started in a couple minutes. Let everybody get in here. While we're waiting, if you guys want to say something in the chat, where you're from, what grade you're in, good information for me and my guests to have. We have somebody from Wisconsin, Florida, and somebody from Florida. Oh, another person from Florida. I'm from Michigan.
Good. Florida people in the house.
Yes. That's awesome. Okay, we can get started. Let me share my screen. Okay, so hi guys. This is our call with Dr. Garlapati. Before I get started, I have some announcements for you guys regarding verification of your hours. So this call will be about 1 hour long. If you're looking for verification of your hours, all those details are posted in the link tree of my Instagram bio. And for just a real quick about summaries, it is going to be a summary for 3 to 4 sentences. It can be in any format. And the point of the summary is for you to tell us that you took something out and you learned something. And it can be any information that you found was valuable from the doctor. And you will email that summary to us. The email is clubmedshoe@gmail.com. And that email is also posted in the link to your Instagram bio. And I will also put in the chat when I get a chance. And you can only do verification for the 2021 sessions, and those will be due sometime in May. We don't have a specific date yet. It's usually like the end of the semester. I know that like is different for everybody, but we'll post a specific date when we get close to it. It's still a couple months out. And we do ask that you hold on to your summaries. Like you can, if you've been writing it, just keep on writing them and have them all together and send them in May. And that way it's easier for us. We have all and we'll send it all to you. If you've been, you can also send them as you go if you need them urgently. I think some people want them right away. But if you send it, it is going to be about 2 to 3 weeks, and that can vary. It can be quicker or later, depending on how busy you have. Sometimes we can get backed up like 400, 500 summaries, and it takes time for us to do them. And it is us doing them by hand. We don't have a computerized system. We read them. It's real people reading them, real people processing them, so it takes time. We also have, so for those who are new, we also have a volunteering page. You can find all information about what programs that we offer. It's by going into the link of our Instagram. It's called @officialclubmed.volunteering, and all information about what programs are offered is posted there. The reason for the creation of this program is because right now during COVID, it's hard to do in-person volunteering. A lot of people are not accepting, so it's a great way for you to get your hours by doing stuff from your house. And outside of that, if you have any questions regarding anything, just DM us on Instagram and we'll get back to you. And that's usually the quickest way possible. You can also email us if you have another query. Okay, that is it for announcements. Today we have Dr. Garlapati. She is a medical doctor. She is a dermatology resident out of Florida. I'll get her to talk. Go ahead.
Hi, everyone. I'm Dr. Garlapati. I'm a second-year dermatology resident based out of Miami, and I'm so happy to be here and to chat with you guys and share my experience.
So Dr. Garlapati, tell us a little bit about your background, where you went to college and how you got into medicine. And
Yeah,
get into medicine.
Yeah, so my experience is probably non-traditional and a little bit different than most people. I actually went to medical school in India right after high school. So I fall into the international medical grad. So it was pretty tough. I'm sure a lot of you know as you're doing your research that when you apply to the more competitive specialties like dermatology, it's extremely difficult. And a lot of the times, if you're considered an IMG or a foreign medical grad, you're kind of already written off. And the reason for that is it is such a competitive field and everybody has great scores, they've had great experiences, they've written a lot of papers. So they try and look for something to kind of weed people out. And being an international medical grad, unfortunately, when you're going for those highly competitive fields, is a little bit difficult. So that was definitely an uphill battle for me. And if there are people that fall into that category, there it definitely is possible. A lot of people will tell you along the way, choose a different specialty. This isn't going to work out for you. But if it's something that you want, you can definitely work hard for it and you can achieve it. So my pathway was a little bit different.
Yeah, that is very unique. I know medical school in India is a little bit different. Since you went out of high school, and I know a little bit about this, so but it's like your undergrad and medical schools combined into it's called MBBS over there, right? Could you tell us a little bit more about that?
Yeah. So actually, my initial thought when I thought about going there, I was in high school and I thought, okay, well, I'd love to live in India for a little bit. So let me go there for undergrad and then I'll come back here for medical school. But then, obviously, as you know, when I was looking into that whole process, they follow the British system where right after high school, you go directly into whatever your profession may be. So they do a 5.5 year medical program where the first 4.5 years is all of your medical courses, you have your clinics, and then they add on what is in the US your first year of residency, like your transitional year or your preliminary year. They add that into as part of your medical training there. So it's 5.5 years. And then while you're there, if you, like for me, for example, I always knew I was going to come back to the US. So I just took the initiative to take my step one, step two, get all of that over with while I was still studying over there so that I wouldn't have lost time coming back here. So that's the only difference is that I know in a lot of US schools, they integrate the step studying into their curriculum. Whereas if you're in a foreign medical school, they obviously don't because not everybody who studies abroad wants to come back to the US or is planning to, settle in the US. So you just take those steps and you take it throughout your course. I know some people that I went to med school with waited till the end of finishing medical school and then took theirs, but I just integrated it into the time I was there.
That's great. That's very unique of being able to do that. How did you find being able to take your board exams? I mean, after I know like the U.S. medical schools prepare you for your USMLEs or complex, depending on if you're going D or MD. How did you find the kind of the coursework that you were doing there in terms of getting you prepared for your board exams?
Yeah, so a lot of people don't know that I feel like medical school is pretty much the same wherever you go. The subjects are the subjects. The human body is the human body. So in that sense, I felt like the education was pretty much the same. I think that I probably just studied a little bit extra and more. So a lot in, British schools and in India, they have more written exams versus multiple choice style questions. But I mean, I was born and raised in the US. I mean, all of our questions are multiple choice style. So taking those type of tests is actually easier for me than freehand written exams. So it wasn't that hard. I mean, I would just spend a little extra time focusing more on diseases and processes that are prevalent in the US because that's what they quiz you on, obviously, for a US based exam. And when you study in places like India specifically, communicable and infectious diseases is highly tested over there because obviously that's more prevalent over there. So you kind of just understand what is more prevalent and what is more, applicable to the US and diseases and states like that. And you just, focus on that a little bit more. That was probably the only difference.
Okay. So yeah, as you were able to prepare yourself by just doing a little bit of extra work and you kind of already knew how the American system worked, so that kind of helped you out too. How did you decide to get into dermatologist and dermatology? I mean, that is one of the most competitive residencies that's out there. And what kind of things did you do to get into dermatology, and why did you choose that competitive field? Did you know that you wanted to get into that field?
Yeah. So initially, no, I actually wanted to do GI initially. My dad was a GI, and I always thought, the pathology in GI was more interesting. I didn't really think about derm at that time. And then when I started to, like in my second year of med school, think, okay, I really need to figure out what specialty I want to do and like spend the next 2 years being hyper focused on that. I talked to my dad about it, and he's like, you should think about dermatology. And I always had an interest in it, but I think in medical school, you're not really exposed to dermatology that much. Even with your clinics, it's always an elective. You maybe spend 2 weeks over there. And, when you read about the pathology in dermatology, they only expose you to, 10, 15 common diseases. And that's what you think all of dermatology is. So I spent a rotation with one of my family friends in the US. I spent about 2 weeks with them, and I got to see so much more than what we see, just in our textbooks. And I saw how vast it was. I personally am a very visual person, and I learn visually. So the having dermatology be such a visual field, it was just like second nature almost. It was like, oh my God, how have I not thought about this field since day one? It just clicked with me. I loved it. I love the lifestyle of it. It's a great specialty in terms of hours, in terms of clinically what you're exposed to. So then in my second year of medical school, I kind of switched completely. And when I started to look into the process of, okay, what do I need to get into dermatology? Obviously, you need very good board scores. So that's when I started to focus on my steps, getting all of my studying done because I wanted to get good scores so I could knock that off my list. Then I started thinking, okay, especially being a foreign medical grad, dermatology requires a lot of initiative. You have to show people that you're super interested in because it's so competitive. So I definitely think taking time off to do research, whether that is within the time that you're in medical school, before you go to medical school, or after you graduate from medical school. I don't think there's any right or wrong answer as to when you should do your research, but you should definitely be involved in research. The main reason for that is number one, you get to learn about a program. You get to learn about the fields in dermatology. You get so much knowledge and exposure, and you get to work one-on-one with attendings, which is really important because especially if maybe you don't have the best board scores, or maybe you don't have a lot of papers that you wrote, or maybe you come from a foreign medical school, like maybe there's something in your CV that you feel like is lacking. Having that personal relationship where you spent a year or so working with multiple attendings at a dermatology program, they get to know you personally, your personality, your work ethic. That speaks volumes compared to, oh, she only wrote one paper, this person wrote 15 papers. You know what I mean? It gives you that personal touch and that personal edge where they're like, I really like this guy or girl. They have great work ethic. Let's give them a chance. And I can say that for me personally, every single one of my dermatology interviews came from programs I personally worked with, whether that was rotations, whether that was I worked with, writing a paper or a project. Every single one of my interviews came from some type of personal experience I had with the program. So I definitely think that research is great. I think writing papers, whether that's a book chapter, a case presentation, whatever it is, getting involved in any type of publication is great because it's a great opportunity for you to learn and to work with people at a program. And going to conferences. So dermatology in general is a very small field. Everybody knows everybody, and going to conferences is a great opportunity to network because you never know if you meet somebody and you're saying, yeah, I'm applying for dermatology. I'm, am part of the match this year, this, that, and the other. Like, would love to know about any opportunities. And they'll say, oh, you know what? There's a spot that opened up in this program. Actually, I heard it through the grapevine. And then you go, you contact the program, that there's so many times that has happened to me where I didn't match the first cycle and I was like, man, I got to figure this out and do this again. And I would hear about a program that, they just had another spot that opened up and I would go rotate with them, show my face, show up. Like, and I literally had one of the program directors say, we put this ad out on, they posted it in some group in Facebook and you were the only one that showed up. So I think that's really great if but you wouldn't know about those opportunities if you don't network and, go that extra mile. So conferences are another great opportunity.
Right. That was great information. what would you, so you said board exams, or do you need, is it required you to have high scores for somebody to go into residency, to have super high? Because that's what kind of people think, that like for derm, you need to have those perfect scores.
Yeah, so I actually think I don't know, and you can correct me on this because it's been a while since I've taken them, but I think that they kind of changed the way it is now that it's just straight pass fail.
That's
uh,
step one. Step one is
Okay.
passing
Yeah.
fail.
So in general, so I think, yes, it's always good to have competitive scores, but just because you don't get, the best score in the world does not automatically mean that you cannot try for a heart specialty. Because like I said, there are so many other opportunities. And I personally know so many of my friends who didn't get the most, amazing scores, but they still match into dermatology or competitive fields because they spent time doing research. They spent time like getting to know a program. They spent time showing up. And it's really funny because a lot of people do away rotations too. That's another great opportunity to, show the program, hey, I'm interested this, any other. You would be surprised at how many people come into away rotations and they're not interested. So people will show up and they'll be on their cell phone, or they'll show up late, or they won't interact with residents. Like, that's so important that if you're taking, a week or 2 weeks to show up to a program, to be 100% present, because there are so many people that when we go to review of, okay, do we like this candidate, we write them out automatically because they were on their cell phone the whole time in the exam room. They weren't even looking at the patient or the lesion when we were examining them, or they showed up 30 minutes late to clinic that morning. So that's another thing to be aware of is, it's not always just scores. Scores might get you in the door, but your personality, your interaction with the program, and honestly, your dedication to the field shows through when you show up. So if you have all those things, yeah, if your scores aren't the best, I mean, you can still get into great programs.
Gotcha. Thank you for answering that. There's a question about the chat, and I wanted to ask about it too. What type of, the conferences that you mentioned, how do you look for those? And is that only for people who are like graduates of medical school or people in medical school, or?
Yeah. So say for example, you're interested in dermatology, you can just Google dermatology conferences, and it'll show you, different links for like ASDS or AAD or ODAC, different conferences. You can just click on their links, see when they are. If it fits into your schedule, definitely reach out to them. I'm pretty sure that they are open to medical students. I don't see why they wouldn't be, but you can go on their registration and it will tell you. And if not, just contact whoever the administrator is and say, hey, I'm super interested in dermatology, would love to attend this conference. Let me know if it's possible. It's always good to just shoot people an email. The worst they can say is no, but at least you tried.
Right. Exactly. Um, that's another way. Somebody asked, board exams are taken after residency. No. If you, by board exams, if you mean your step one and step one, that is taken in medical school. You can correct me if I'm wrong.
No, that's true. Yeah,
Yeah.
they're not taken after residency.
So for you, so when you were doing your when you were in India, did you take those when you were doing your medical school in India, or did you
Yeah.
take?
So I completed my step one and step two. I think it was CK. I completed those when I was in medical school, and then CS I had to do here. And then I did step three right before I started my intern year.
Um, for someone who's like starting out, like how do you recommend like networking with doctors and stuff like that? So you're kind of like out there to do this.
Yeah. So what state are they in? Like, are they in medical school
Um,
or are they in
let's say
undergrad?
undergrad. Let's say undergrad, high school type of.
Okay. So if medicine is something that you want to go into, and say, for example, you're already an undergrad, if your school has a medical school associated with them, I would reach out to them and say, hey, like if you're trying to get into medical school, like I would love to come to a conference. I would love to attend your grand rounds. I would love to, attend your journal club. So usually grand rounds and journal clubs are social events where it's education based, but we're pretty open to allowing rotators, students, anybody honestly who's interested in the field, to come out to them. So, and it's great because it shows that you're interested. And even with that, you can get so many opportunities.
Sorry, I just had to shut my door.
No problem.
Um, there's a question in the chat. Well, difference between step 1 and step 2 for the board exam. I'll let you answer that.
So when I was applying and when I was going through the whole process, I think step 1 was weighted a little bit more. Now I don't know how it is just because they've changed the scoring system.
Okay. How many years are you an intern for residency? Oh, for dermatology? I think she means like how long is your dermatology
Yeah.
residency?
So dermatology residency in itself is 3 years. And then prior to starting dermatology residency, you have to do 1 year of either internal medicine, which is like a preliminary year, or a transitional year.
So when you're applying for residency, do you apply into internal medicine residency first and then you apply to dermatology?
Yeah, so the way you do it is they're 2 separate applications. So one, it's all through the ERAS, it's all part of the same match system, but I would apply separately for my prelim/transitional year, and that's like a separate personal statement, separate letters of recommendation, and then I also put in an application to dermatology programs, which is a different personal statement and different letters of recommendation, but your scores and your transcripts from your schools are sent to both.
Okay. So let's talk about currently your residency that you're doing right now, your lifestyle and kind of things that you're doing. So could you talk more about that, like your lifetime as a dermatologist resident?
Yeah, so derm residency in general is a great specialty to be in. It's honestly regular clinic hours. So, for example, my week, let's just take right now, for example, I'm on my general dermatology rotation. So, my hours are pretty much 9 to 5, Monday through Friday, and then Wednesdays are our dedicated academic days. So, basically, Monday through Friday, I go into clinic, I see patients, I staff the patient with my attending. Each resident depends on the schedule, how many residents are scheduled. But usually we see anywhere from 15 to 20 patients on our own, and we staff them with the attending. And then on Wednesdays, it's our dedicated academic day. So we have lectures in the morning. We do some dermatopathology where we read slides, and then we have independent studying for the rest of the day. And we don't work weekends unless our program, specifically first years, they're on call. You have to take call in the hospital. And when you're on call or when you're on the inpatient service, you have to be available pretty much 24/7, including the weekends. But once you finish first year, second and third years, we don't take calls, so we don't have to work weekends. So the schedule's pretty great. I can't really complain about it at all. You have enough time to study, you have enough time to do whatever things you need to do personally.
There was another question for those. There's a lot of students that we get, our high school students. For them, she's asking, could you attend a conference call when you're still in high school?
I don't see why not. Like I said before, I think that you just need to contact the conference, whoever administers it. I'm pretty sure they're open to letting people attend. So I would just, email them, see what they say.
Gotcha. Another question in the chat. I like this. This is about can dermatologists work at a hospital, and what is the difference between what they do at a hospital versus clinic?
Yeah. So there's a couple different settings in which dermatologists can work. One is private practice, which is an outpatient clinic. The other two is associated with an academic institution where you're part of a residency program or whatnot. And number three is most times you don't have exclusively an in-house dermatologist with an inpatient service, just because inpatient cases aren't that heavy. So if you go to a lot of hospitals in general, you will notice that there isn't an inpatient dermatology wing or center or floor. So a lot of the times, dermatologists who are in a private practice will have hospital rights. So what that means is if somebody gets admitted to the hospital and they have a dermatologic condition, or they're admitted for, an IM condition, and, they want derm consult because they have a new rash that developed. Maybe they had a drug rash from a medication they started them on. They will contact the dermatologist that's on staff at that hospital. So I could work at a private practice, but I could be on staff at a hospital. They can consult me, and I go in after work and see the consult. So that's usually how it works.
So you kind of do both things at the same
Yeah,
time, depending on what's needed.
yeah,
That's good too. Balances both things out. You get hospital experience and clinic experience.
yeah.
Is that what you're looking to do also when you practice, or kind of want to have your own
So
clinic?
I think I might. So my husband's a dermatologist as well. So he's
Oh,
practicing. Yeah. So he's been practicing for about 5, 6 years. So I think I might just do more of a private practice setting.
okay. Does he have a private practice too, or is he working in a hospital right now? Kind of, or doing a mixture of
Yeah.
both?
So he has a private practice setting, and for the first couple years he was on staff at a hospital. It's also a good way when you come to the stage that you are running your own practice. Being on staff at a hospital is actually a great way for you to get patient referrals, because
Yeah.
once that patient gets discharged, they are going to follow up with you in clinic. It's also a good way for hospitalists to get to know, oh, Dr. So and so is a dermatologist in the community that we can refer to. So when you're at that stage, it's a great opportunity to funnel patients to your practice and grow it.
Yep, grow your business out, and the best way you can do is by being exposed, being in a hospital where your name is out there, and there's a clinic in town.
Yeah.
Yeah, that's good. Sam wants to know what your favorite class was in med school.
That's a good question. My favorite class in med school is probably anatomy.
What about your least favorite?
Oh, pharmacology.
Pharmacology. I've
Sure.
actually heard about that, and I was actually talking to my advisor about it. She recommended that like a lot of people get really low grades in pharmacology, and if you're in undergrad, you should actually take that class once before, so you kind of expose the material once, and then you take it in med school, so you kind of have a base to work with.
That's a really smart idea, because if you just get introduced to it once, it's so overwhelming.
Really? Yeah,
Yeah.
that's what I've heard. I'm planning on taking that sometime in undergrad. But moving on. What are some fellowships and specialties that are associated with dermatology?
Yeah, so there's a couple different fellowship opportunities. So one is Mohs surgery, and that's so all of derm fellowships are 1 year. So Mohs surgery is skin cancer surgery. So you spend an entire year doing skin cancer surgeries, and then there's dermatopathology, where so part of dermatology is reading slides. So we take a lot of biopsies. They process the biopsy, the tissue, and they put it on a slide, and you read it as part of dermatopathology. That's also one of the cores that you learn within residency. So that's another 1 year fellowship. And then you're able to do, if you're interested in cosmetics and lasers, they have their own fellowship. And then pediatrics also has its own fellowship. So there's a couple different opportunities based on what you're interested in.
Um, Let me look at the chat. I think this might be a good time for us to move into the case study that you have.
Okay.
Yeah.
So how do I share that with you? Can I share my,
So if there's a button right in the middle, let me see. Let me give you ability to share first. Go ahead. You should be able to share.
let me see. Okay, there's, can you see that?
Yes. Yes.
Okay.
Drop in
So,
the chat if you're not able to see it, because I am.
okay, perfect. Okay, so I basically wanted to, I don't have a specific case. I just kind of wanted to talk about acne vulgaris in general. So this is one of our bread and butter cases that we see in dermatology. And I kind of wanted to walk through how do you assess these patients, what do you look for, and the different treatment options based on whether it's mild, moderate, or severe acne. So I'm just going to throw up some pictures. In dermatology in general, we mainly focus on Kodachromes. Kodachromes are visual images, and that's kind of how we do the majority of our learning. So I thought to kind of be in sync with that, I'll just show pictures and we'll kind of talk through them. Okay, so this is a patient that has mild comedonal acne. Comedonal acne in general is basically known as your whiteheads and your blackheads. They're very common on the forehead in general. And usually what happens to get to this state are there are four main reasons of why you develop acne. One is abnormal keratinization. And what that means is the little pore or your hair follicular unit is obstructed. And once that gets obstructed, there's a couple different processes that occur. You have increase in oil production, which accumulates in the follicle. You have bacteria that overgrows in there, and all of this leads to inflammation. So this right here, what you're seeing is you're seeing these comedonal papules, and you can see that they're not very red. They're kind of flesh colored. So there's not a lot of inflammation going on in this patient. So at this point, anytime you see an acne patient, the first thing you want to do is obviously assess their face, but then acne can also occur on the chest and back. So you want to check their chest to make sure that there's no lesions there, and their back as well. The main reason for this is if they have any chest or back involvement, no matter how mild the acne is, you can't really just treat them with topicals. You have to kind of bump it up to systemics because you have larger areas of the skin that's involved. But say this patient walks into your clinic, they just have this. You also ask them a couple of other things, what products they're using. A lot of the times patients are using products, whether it's on their face or their skin, that can actually clog their pores and worsen their acne. So if you have a patient, you've been treating them with different topical regimens and they come back after 3 months and they're like, you know what, my acne just isn't getting better. It's probably because they're applying something to their face that's making it worse. So you always want to go through their history, understand what products they use, what skincare, and any type of hair products, specifically because when a patient uses hair products, they're usually very comedogenic, which means that they can clog your pores and lead to acne. And they usually get acne along the hairline. So that's something that you want to ask them. So when a patient presents with just mild acne like this, there's no inflammation, there's no pustules, you can treat it with just a topical regimen. So at this point, the first thing we do is we walk them through their skincare. We'll put them on a benzoyl peroxide wash. Benzoyl peroxide is great because it has antimicrobial properties. So it treats one of the components, one of the 4 components that lead to acne. And then you also want to put them on a topical regimen. So topical retinoids, which are vitamin A derivatives, work beautifully in comedonal acne and acne in general. Any patient that has acne, you always want to put them on a retinoid. It's great for treating the acne that's there and also preventing new acne that's forming. So in this patient, I would start them on a benzoyl peroxide wash, like panoxyl face wash, and then I would put them on a topical retinoid at night. Give them about 3 months. It takes 3 months to see anywhere from 60 to 80% improvement. So you want to tell patients, be diligent. Acne is something that definitely doesn't get treated overnight. It's a process, but with consistency, you see results. So usually patients like this, I would start them on a topical regimen, and then I would see them back in clinic in about 3 months to see if there's any improvement. So that's mild acne. So then this is a patient that has more moderate acne, and there's a striking difference between the previous slide and this slide. Here you can see that they have inflammatory papules, pustules. There's even some scarring in here. You can see these are going to be some atrophic scars. So these patients, they need a little bit more than just a topical regimen. So you kind of bump them up to the next phase. Again, we keep the same thing that we would have in a mild regimen, which is the topical benzoyl peroxide wash. I'd probably add in another topical antibiotic for them to use in the morning, such as a clindamycin solution, which is, combats one of the components of acne, which is the bacterial overgrowth. Then I would keep the topical retinoid at night. We talked about, the benefits of that. But then I would also add on an oral component. And one of our go-tos in dermatology is oral doxycycline. So this is an antibiotic, but we give it at a low dose of 100 milligrams, usually once daily. And at that dose, it actually has anti-inflammatory properties. So it's going to bring down all of this red inflammation that you see. It's also going to help with some of the bacterial growth. One of the benefits of starting out at once a day is if the acne, say they come back in 3 months and they're like, you know what, my acne got a little bit better, but I definitely want it to be even more clear, then you could always bump them up to doxycycline 100 milligrams twice a day. So the difference between mild and moderate acne is now we have added another topical solution in the morning, and we've now also added a topical or an oral antibiotic. So once we get to this stage, this is severe acne. It's nodular cystic acne, and this is something that either the patient has failed, our traditional regimen of oral antibiotics and topicals, or they walked in for the first time, you're seeing them, and this is how they're presenting. And you say, okay, this is pretty severe acne. We have deep nodules. We might have some cysts that we're not able to see. There's some scarring going on. There's a lot of inflammation. And we want to treat these patients early. And the reason for that is the longer you let acne lesions sit like this, the more scarring the patient is going to have. And scarring is a whole different arm with acne patients that you have to address. So for these type of patients, you also want to check their chest and back, because a lot of the times when you have severe acne presenting on the face, you're also going to have lesions on the back and chest. So for example, you can have deep nodules like this, and you can see a lot of this is scarring. So when you get scarring like this, it becomes very difficult to treat. And a lot of this is the scarring is permanent. So you definitely want to get these people on a regimen sooner than later. And you can also have lesions on the back. So usually when a patient presents at this stage, we have more of a go-to medication, which is Accutane or oral isotretinoin, which is an oral vitamin A derivative. This medication is taken very seriously. You actually have to enroll these patients in a government-run iPledge program. And the reason for this is there's a lot of side effects that can occur with this medication. It's actually teratogenic, so you cannot get pregnant while you're on this medication. And all of those things are monitored while you're in the iPledge program. You have to get lab work done initially because the medication can affect your lipid profile. So before we start anybody on this, we make sure that, they're part of the iPledge program, they fit all of the criteria, their lab work looks good, and then we start them on this medication. Usually the course that they're on this is for about 6 months. I've seen patients improve tremendously on this. Their acne almost clears, and then we're just left with some of the scarring, which once all of the acne is cleared, they've been off Accutane, for 3 to 6 months. Then we start them on more of cosmetic treatments where we address the acne scars with various chemical peels, microneedling, lasers. We have a whole arsenal of things that we can do to kind of combat that process. But that was pretty much, I kind of just wanted to walk you guys through the different types of acne and how we treat it.
I think that was, that's definitely, I had a lot of acne issues too when I was a little bit younger, but it just kind of went away with age. But there's a question in the chat. What kind of things are good to do at nighttime for your skin?
Yeah, so I'm going to stop sharing my screen. Is that okay?
What's that?
I'm going to
Yeah,
stop
you can
sharing.
stop sharing your screen. Yeah.
Okay, cool. So there's a lot of things that you can do, and honestly it just depends on your skin type and what your personal concerns with your skin are. I think at nighttime the best thing to do is make sure you wash your face. A lot of the times, especially younger individuals, they don't wash their face at night, or they'll just throw water on it. So it's really important to wash your face, to wash off all the oil and debris that you've accumulated throughout the day, because when you go to bed, you don't want all that just sitting on your skin, because you absorb that, it goes into your pores. So wash your face, apply a moisturizer. You don't have to spend a lot of money on these products. Honestly, just, whatever CeraVe, Cetaphil, Neutrogena, those are all great products that you can get at the drugstore. And if you want, you can start using a retinoid. Retinoids, as what I was talking about, or retinol, which you can get over the counter, are great at preventing acne. They're great at evening out any dyspigmentation you may have on your skin. They actually increase collagen production. So all this anti-aging marketing that you pay so much in these skincare products, you just need a prescription strength retinoid from your dermatologist. It'll save you a lot of money.
Okay. A question from Jacqueline. Does scarring, I know like after acne you get scarring, does that go away with time, or do you prescribe something to the patient to get rid of it?
Yeah, so acne has different types of scars. So it kind of depends on what the scar may be. If you have like some hyperpigmentation, which is really common in ethnic skin, that'll fade with time over a couple months. But if you have like ice pick scarring or deep scars, those don't go away on their own. So there's different in-office modalities we can do to help them. Retinoids may help a little bit because they increase collagen production. But usually you need some type of in-office treatment like microneedling, chemical peels. There's different things that we have in office that can help with those.
Thank you for answering that. I have another question for you. It's from Yasmin, just talking about dermatology. What's the most challenging part about dermatology that is normally not talked about?
Um, the studying.
The studying.
So dermatology has over 3,000 diseases, and you are tested on every single one of those diseases on your board exams. And you don't see a good, 40%, 60% of those you will never see in your life, but you are expected to know every single thing. So I think that's one thing that I didn't know when I was starting out, that it was so challenging. A lot of people think, oh, you just treat pimples all day. But no, there are some very intricate diseases. There are genetic diseases. There's so much within the field. So I would say probably academically, it's the most challenging to learn everything.
Of course, studies is always hard, but if you're passionate about it, it's not hard.
Right.
From Isha, what is your favorite and least favorite part of being a dermatologist?
So my favorite part is probably the cosmetic aspect of it. Seeing a patient improve, especially when it's their skin. Your skin is the first thing people see, and there's a lot of debilitating diseases that can really affect your self-esteem. So when you see a patient clear because you put them on this regimen and they improve, you see the difference from the first day they walked into your clinic to now they're fully clear, and you see how much of a difference it makes. So I think that is probably my favorite part and the most rewarding. My least favorite part is probably dermatopathology. I'm not, reading slides and sitting in the lab with a microscope is, not my favorite aspect of it. So, and it is challenging to understand slides and the different cells. And, that was really challenging my first year. My second year, I kind of, things are clicking and things are making sense now, but it's just not my cup of tea.
Gotcha. These are going to be some like questions here and there, but I've actually wanted to wonder this too. Somebody asking, just is it true that just using Dove soap is better than a bunch of skincare products for your skin?
Yeah, less is more. Like
That,
whoever is like sitting here on TikTok and like Instagram telling you to put like 10 products on your face, like, no, you don't need it. Like literally simple is so much better. Like it's more important to invest in active ingredients that will improve your specific skin concern than putting a bunch of things on your face. And I actually know this from trial and error because when my husband was a resident and I was like still trying to get into derm, I kept telling him like, what product should I use on my face? Like, tell me what to use. And he's like, dude, just use CeraVe and Cetaphil, go to Walgreens, get a face wash, get some cream. Like, that's all you need. And I was like, oh my God, he's a guy, he doesn't get it. And then I would put all these products on my face and I would always break out. And I was like, clear my skin. He's like, well, you're rubbing all this like mask and all this stuff, and all of it's just clogging your pores. And, sometimes ingredients don't work well together. So when I started my residency and I started to really understand the skin and understand how everything worked, I cleaned out my routine. I probably use like 3 products in the morning and 3 products in the evening, and that's it. So I definitely believe that less is more.
I agree. I don't really have much of a skin routine. I just use standard soap, and I think it's done just fine.
Yeah.
But another question: do silicone sheets work for scars? I don't even know
Yeah.
what that is.
Yeah, so silicone in general is a great ingredient that we use with scars. So silicone sheets are great for scars.
From Emma, she said, I've heard there's adverse effects for retinoids. Is that true?
Yeah, so there's a lot of side effects that you can get with being on a retinoid, but to be quite frank, the benefits of your acne being cleared clearly outweighs the risks associated with it. And honestly, your dermatologist will check to see if you're experiencing any of your side effects. We're completely on it. We see you once a month. We only give you prescription for 1 month. You have to come back and see us, clear that you're not experiencing any side effects, and only then do you get your prescription for the next month. So though that there are side effects with it, it's very heavily monitored and we're on top of it.
Okay, just a couple more questions because we're running low on time. Just I don't. You said like, but I'm gonna ask you again. What is a good soap in your opinion to just use on the regular?
Yeah. So I always say these two companies because honestly, they're trusted by dermatologists and they're so great. CeraVe or Cetaphil. I mean, they're the washes that my husband and I use. I recommend them to all my patients. Just a gentle cleanser is all you need.
Okay. Do dermatologists treat hair problems too? Is that
Yeah. So we are the specialists in skin, hair, and nails. So we do treat hair and nails as well.
okay? Um, I'm gonna ask the last question. Are you going to pursue any specialty within dermatology, or do you plan on?
So I'm interested in cosmetics and aesthetics. So I don't think I'll do a separate fellowship in that because each program and a lot of people will understand this as they go through the interview process and try and understand programs in general. Each program is heavy in their own things. My program is very heavy in cosmetics. We get a lot of exposure to it. So I don't really feel like I would want to do an additional year of cosmetics because we get a lot of training in it.
Guys, that is it for questions. I'm sorry if I didn't get your questions. I tried my best to answer all the questions. But before you go, I just want to ask you if is there any last bit of advice you'd give most of the people here and are high school undergrad? Any kind of last piece of advice for somebody pursuing dermatology so want to get to know more about it or medicine in general too?
Yeah. I know what it's like to be at your state because I remember being there. It wasn't that long ago, and it seems like it's such a long, arduous process. But if you're passionate about something and you want to do it and that's important to you, do not let anybody say you can't do it. Do not let anybody say you're not going to make it. And those times when you feel like, damn, this is really hard. I can't study. I can't get through this. You can. Just keep doing it. And one day you'll be sitting in my position and we can all talk about how great your field is.
Awesome. Thank you. Thank you so much for taking the time out of your day for coming to speak with us. I think you provide a lot of useful information. A lot of people in the chat got a lot of their questions. This is actually probably one of the highest amount of questions that I've asked from the chat, and they were able to get answered. So thank you for that, and thank you for your time. Before we close, I have a couple more things to say. For those who this was their first time, we have calls every single week, depending on what you're looking for. I saw a lot of interest in dermatology, so if this was a call that you really enjoyed, we're going to have future calls with dermatology. Also, we had a dermatology PA too. A couple weeks back, I think she was good too. So if that's something you're interested in too, be sure to check that out. Additionally, you can set up from Instagram by clicking the link in our bio. You can set up weekly reminders. I know we haven't been sending them out. Our email service was like shut down for a couple of weeks, but today I just was in touch with the company. It's good to go now. You will be receiving should be receiving emails next week, hopefully. So yeah, and if you have any questions in the chat, be sure to DM us on Instagram. Thank you so much, guys. Have a good day.